Okay.
or cavernous malformation.
Okay. So, of course, you cannot 100% be sure unless you go take it out. If it's a cavernoma, we don't have to do anything about it. Okay.
It means a developmental abnormality of the vessels. No, it's not like a balloon in the vessel or an arterial or venous malformation that requires emergent surgery or taking it out. It's actually a lobule, vessel, lobule as you think. It's just like a little thing in there which is calcified, which means it's been there for a little while already. That it comes possibly from birth. And sometimes it runs in the families. That's what I was asking you, if there was anyone in the family with the same problems or anything, but no. And sometimes it runs in the families who are like Latin American origin, like Hispanic origin, but you're not, as far as I understand. So I think this is just an incidental finding. What happens is it may cause seizure or seizure-like activity. If it causes seizure activities that are not controllable with medication, or if it causes him some neurological problems, such as this part of the brain is fairly safe, it's not near the areas that control your arms, your legs, or your speech, or your movement or sensation. So if you see seizure or seizure-like activities, that might be one reason that we go after. The other reason, if it actually gets bigger and then causes trouble to the surrounding normal brain tissue, then that might be another reason that we take it out. It may get bigger by bleeding into itself, but those bleedings are like little blood.
But it is actually bleeding. Is it actually?
It's not bleeding. So what happens is sometimes it may bleed into itself and then get bigger, which is rare. And that's how they get bigger, if they get bigger.
Okay.
It's expected to get a little bit bigger. Sometimes the babies, of course, it's difficult for the babies, but the big kids say, oh, I have a sudden headache, but then it goes away. Then it might be just that thing just bleeding, like it's blood oozing into it. It's not continuously oozing. It may ooze, and if it does ooze, it may make it bigger.
Okay.
It doesn't mean that it's going to happen to him. What we do for these patients is we watch them regularly. So I will have him come and see me in about a couple of months. We'll do another MRI in the next 2-3 months to watch it, to make sure that it's not getting any bigger or it's not causing any trouble.
How often will y'all?
Usually I follow them every year.
Why are they every year?
Because they don't really need any surgery, and it's usually a benign lesion which doesn't cause any
The thing
trouble.
we're talking about is about the size of my fingernail, maybe even smaller than that. I mean, it's tiny.
If it was to just start growing, just say tomorrow, how fast could it grow?
It's been there probably very, very long time since his birth. So it's just like a very
It's
little
only a
tiny
year.
thing. So it doesn't. If it grows, it doesn't grow very fast. It may take years or years for him to grow. Of course, there's no guarantee for it. That's why we watch him very carefully. Actually, some people just don't watch him, or some people just watch him every few years. For kids, we watch him very often.
Could our requests or sooner, like maybe every 3 months, every 6 months
You
to
can
watch?
request, but it doesn't mean that I'm going to do it.
Okay,
Because
well, we
it
can
doesn't.
find somebody.
It's
that
not
probably will.
necessarily needs to be done. That's the whole thing. I don't think it's necessary to put him through the MRI, or through the
risk of
machine,
sedation
through the
and all
sedation every 3 months. It's a benign lesion, as far as we can tell. What I do is I watch them very often for the first year to make sure that this is not anything else. It doesn't look like a tumor. It doesn't look like an abscess or an infection. It doesn't look like anything else but a cavernoma. However, the MRI imaging shows us that it's a cavernoma. However, of course, there's no guarantee unless you go take it out, which means surgery. At this point, this is an incidental finding. If it were in the eyes, and I'm not sure why they did the CAT scan for the eyes, because it was just because the eyes were not, it wasn't that his neurological condition was abnormal. It's just he wouldn't
open his eyes, right?
Yeah, for a few hours
Yeah.
though.
Yes, so I think that's why they were
he was just
afraid.
sleeping so long.
Afraid, but I don't think this was related to what we found in the head. I think we found the thing in the head
Could it
just
be?
because
But
incidental.
could it be related?
No, I don't think so.
Okay, because I was reading about a lesion and it named that that could happen.
This in a certain
Mm.
location and this certain location, how small it is, and no mass effect whatsoever, and it's calcified, meaning it's been there for years. It's not worrisome for it. And it's not like every time this kid gets a headache that you have to worry all of a sudden, oh my God, his brain is hemorrhaging. No. I mean,
But that's the scary
not-
part about it because he's so young and I don't know if he's having a headache.
Well, you'll watch him very carefully, and what as you're doing. The thing is, this is not in a place that can cause the eye problem. It's not in a place that can cause him not to open the eyes. It's not in a place that can cause him, vision problems.
Mhm.
It's in a benign place. It's away from very important structures of the brain.
Actually, how deep is it?
It's just, under the brain surface.
Okay.
it's actually in a place where we could probably take out the entire lobe and, well, or at least the anterior,
be okay
and he
with
would be normal.
But we don't
Okay.
want to do any unnecessary surgery
Unless,
because it doesn't, we have a lot of patients that we follow with the same problem and they
Okay.
never require surgery. They may, but that's why we watch it.
only if he started.
If he
she
has a
started to get bigger
problem,
seizures.
Yeah, or if we just think that this is related, whatever he has is related to this lesion.
Okay.
Okay?
What are some of the other symptoms? Is it just seizures to look for?
It's seizures is one thing,
Headache.
acute onset of headaches with loss of consciousness or, not waking up, something is abnormal. It's not going to be that he's not moving his arms and legs well, but it might be lethargic, seizure.
What about not sleeping?
It shouldn't cause any problem
Okay.
with sleep. It should not be causing him any headache either
Okay.
at this point.
And the possibility of it causing seizures to being
That's small.
away from the cortex in the deep part
Mhm.
is lower as well, as opposed to other cavernomas that may be on the surface of the brain.
Mhm.
It's the surface of the brain is the area where it causes more the seizures. This is below the surface
Below.
of the brain. What else? There's no other abnormality that we saw in the MRI. There's not a big vessel or anything in there. Again, it doesn't look anything that is pushing around the normal tissues.
About from a scale 1 to 10, how serious would you say that is?
3 or that's it.
How serious would you say from a scale of 1 to 10 it could become?
I don't think it's gonna go anywhere above 5. We're doing the MRIs to make sure that this is what we think it is.
Mm-hmm.
We don't want it to grow fast.
Yes, ma'am.
That's why he's gonna come and see me in the next 2 to 3 months for another MRI. He needs to be sedated for it like they did today, and then we'll look at it. Then probably do another imaging in the next 6 months,
Okay.
and then if everything looks stable for the first year, then it goes every year.
Okay, that's understood. Yes, ma'am.
3 months, 6 months, and then every year. If everything looks stable. If something is different, then we watch him more closely. More often.
Would that affect like his ability, like to do things kids his age should I?
It shouldn't affect him doing things. If you're asking about restrictions of
Mhm.
activities, and we don't really restrict the activities of our babies, they do whatever they want to
Yeah.
do. One thing that you have to keep in mind is just like the contact sports.
Mm-hmm.
Of course, if he wants to play football or
Yeah.
basketball, he has to be very careful if he gets head to head. There's always a risk of impact, but it shouldn't cause bleeding per se. We just want the families to be cautious.
I think that's the you want to be discharged. Was it 1580?
Yeah,
1380?
41380.
Yeah,
41380.
1380. Yeah, she pays me a second.
Any other questions?
I had a few. I was typing them up as y'all was walking through, so I stopped typing.
We'll find a lot of information, not all the information.
Can I get
that
copies of the scan?
you can.
Okay.
You can get the copies of the scan and all the rest of the information,
Please.
but you have to go and sign a release form.
Mm-hmm.
And then you have to go to the medical records and sign a release form.
Okay.
If they don't release it to us, you have to go request it yourself.
Okay, so I need it's the medical records here.
Here.
Okay.
And then the radiology. Ask your nurse, they may be able to help you out.
Okay.
And that's so easy.
Okay.
And our notes will be in the computer as well if
Awesome.
you want to take them.
Yes, ma'am. So we're not looking at any medication unless he's having seizures.
Nope, not for
Or
this. Not
it
for
get bigger.
Yeah.
Okay.
And I was worried that with the eyes it might be infections, an abscess in the brain, but it doesn't look like an abscess.
Okay.
That's what I'm doing the imaging a little bit earlier, just to follow it closely.
Yes, ma'am.
But of course, if he has more fever, some change in mental status, seizures, not acting like himself, call us or bring him back.
Okay.
They'll give you our numbers to call, and there's always here from your surgery, always somebody here from your surgery 24/7.
Mhm.
And our nurses answer the calls, and
So that could have been the reason why he was falling asleep as he was on me.
I don't think it is the reason.
I think it's probably just because he was infected and
Yeah,
feverish.
fever.
Mm-hmm.
That's why. I don't think this is related to
And
anything
he didn't
that's
want to
happening
open his
at
eyes
this time.
because they're
It was just-
infected and they
okay.
hurt.
Yeah.
We think that it's just incidental finding. We don't think it's related to this.
Okay.
It would be very, very strange if this is related to that.
Okay. Okay.
Any other questions that we can answer for you?
Anything?
Any other questions, sir?
Not for me.
That's all I could think of. that
You're
they-
recording this though?
Hmm. So we can go back and listen to it.
Yeah,
Okay,
so
that's
I
good.
know for sure. I did my little notes, but I'm swapping him and probably
That's
missed a
totally
lot.
fine. Okay.
All right, thank you.
No
Thank
problem.